For me as a consult psychiatrist, the kinds of things that I see most commonly are on the medical and surgical floors. Delirium is probably the most common thing. So people who develop an acute confusion as a result of some underlying medical process or as a result of a medication that they're given. So that's a temporary thing, but it can be very distressing for people. They can hallucinate, they can believe that the nursing staff is trying to harm them in some way. That's the most common thing we encounter sort of in the hospital setting. In the psychiatric emergency room, where I also work, we see a lot of people who come in suicidal, some people who come in with suicide attempts, or some people who are just thinking about hurting themselves. And then we see a lot of patients with issues with substance use. So in Boston, we see a lot of people who are using heroin or cocaine and alcohol, who are then having depression or other things as a result of their substance use. And then we do a couple procedures in psychiatry. This is something that a lot of people don't know about, but for some psychiatrists, they actually can specialize in something that's called neurostimulation or neuromodulation, which is really procedural psychiatry. And that involves things like electroconvulsive therapy, which is a process that induces seizures in patients with chronic illness to help with schizophrenia or to help with bipolar disorder. And then there are also things like transcranial magnetic stimulation, where we use magnets to kind of alter brain circuitry, as well as deep brain stimulation, similar to what you would use for Parkinson's disease, that can also be used for people with very severe depression. So it's a small number of psychiatrists who specialize in that, but there are actually a few procedures in the field as well.